Okay, we have a 17-year-old patient of ours. She doesn't look like she is sick or anything, but we have operated on her how many days ago?
1 week ago. Yes.
Okay, she's from Australia, and as you can see, she's not very obese, but her BMI is around 31 or 32, maybe 33. But still, he needed surgery for her obesity treatment because she had metabolic syndrome. Her liver enzymes were coming up, and she had insulin resistance already started since 6 months. So, and we did it. Now I'm gonna talk with her shortly about what she has to do during the first weeks and the first month of surgery. First of all, let me ask her how does she feel with this process, and I mean how was the operation and afterwards the first few days, because you are a very young patient. First of all, thank you very much to accept this interview with us. This will surely be helpful for other youngsters who may need this. So let's hear you for a while.
Well, when I went into the endoscopy, I thought I was going to wake up again and see all the doctors and then be put to sleep again for the surgery. So when I woke up, I'm saying to my mum, "Is the endoscopy done?" And she said, "No, it's all done." So you can imagine how pain-free and completely clueless I was that the surgery was done, which was the biggest positive in my opinion. I'm someone that's scared of needles and scared of blood, so a surgery was quite a daunting thing for me. But when I woke up, I didn't even realize that I had been operated on because of the care and precision of the doctors. So in terms of the actual surgery, I was really, really happy. The days afterwards, there was a little bit of pain when I sat up, but other than that, just mild stomach pain, and I'm fine, really.
Okay. Yeah, because since this is all we do is laparoscopic work, there are no incisions. Pain is really not an issue anymore. So it's good for you to talk about this in your own words. Now, it's already 1 week past after surgery, and this month you will be changing your diet almost every week. First of all, during the first week, the clear fluids, liquids, were the main thing, and now from now on you will be able to drink thicker soups, and other week purees will come up, and by the end of the month you will be trying small fish bites, like maybe some mince you can have, but big pieces of meat like bone filet and stuff like that, you'll be able to eat them not earlier than 3-4 months. So animal protein, since it is very important, every protein molecule in our body has a function. So in the condition after bariatric surgery, when you cannot take animal protein enough, it is very important to provide protein support to you for the first 3-4 months when you are still unable to eat big pieces of meat. So also, once we discharge you in the 3rd day from the hospital, we asked you to do your injections for another week. What kind of injections were they?
I'm pretty sure it's an antibiotic. Is it?
No. It is a blood thinner. Some centers around the world do not use it once they discharge the hospital, but in our protocol we give them another week in order to avoid deep vein thrombosis, which is one of the most important complications of operations done on obese patients. So we avoid it by using blood thinners, some other mechanical devices as you were using them in the first 3 days when you were in the hospital. And also, you should drink enough fluid every day. The first reason for patients to be rehospitalized after they discharge is dehydration. So just take care that, especially during the summer, in the first upcoming weeks, you should drink like 1.5, maybe 2 liters water every day. And also you should take one other thing you should take all your life. She's been through a sleeve gastrectomy. The procedure we did on her was sleeve gastrectomy. And once you have this operation, patients need to take an oral pill for the rest of their lives. What is that pill?
It is the one that melts in the mouth. So.
Which is, what is it? Vitamin.
Vitamin.
That's a vitamin. The only thing you should take all your life is a vitamin. And now you will start to lose weight. Your insulin resistance will be even lower now. I'm sure we didn't check it, but because the effect of sleeve gastrectomy on type 2 diabetes is immediate. It doesn't follow like you lose all your weight and then you get some benefit. No, it doesn't work that way. The minute you have this operation, there's effect on type 2 diabetes. So that's why you won't be facing hypoglycemic attacks, which were a problem before. Do you realize that your appetite is less now, or you don't realize it? What do you think about your position now? Are you carving for some
Craving.
How do you explain your situation to your fellow patients? Let's say,
Well, before the surgery, I was probably had the biggest appetite in any 17-year-old girl ever. I would get peckish straight away. Even if I'm full and I know that I'm full, I would always want more food. But after the surgery, it only started yesterday a little bit that I felt like something a little bit savoury, because I have been having sweet protein shakes and sweet fruit juices. But other than that, for 6 days, I haven't wanted food at all. Even the thought of food didn't appeal to me at all.
Yeah. This is something very important what you are confessing now, because in contrast to what was happening with the band procedures before, this new modern bariatric procedures, including sleeve gastrectomy, has a hormonal effect. It decreases the amount of a hormone called ghrelin in blood, which is the hormone which is responsible from our appetite actually. So after having these modern new type of bariatric procedures, you eat less, but you are satisfied. This is the main difference between the band procedure, which is almost abandoned actually. So one other important thing that everybody should know, that when one has a bariatric procedure, this doesn't guarantee that you will regain weight. So for the first few years after surgery, there is no way that you don't lose weight. That's guaranteed. So you'll be very happy in the end of 1 or 1.5 years. But afterwards, if you don't take care about your dietary habits, if you do not integrate exercise enough, and about 5% of the patients may regain weight to an extent that they may require a second procedure. Sometimes some people are going under a third, even fourth bariatric procedures worldwide now. So this is a known thing. So there's no guarantee. So you should always have in mind that your metabolism will call you back, but you have to resist on that. Since you are very young, this is a very, very important issue. Do you understand that?
Yes.
Thank you very much. Thank you very much allowing us to do this interview. Yeah, okay, if you have some more words.
I just want to say a big thank you to the whole team at Istanbul Bariatrics. My whole experience from start to end, and not that it's ended, has been very, very pleasant and very nice. And anyone who's thinking about getting the surgery, I would strongly recommend to come and have a consult, and you'll fall in love with the team, and I'm sure you'll be very happy.
Okay,
Thank you.